Just a second here. Okay. Link there. All right. I'm going to open it up for folks. All right. And folks should be coming on in here. Just give folks a minute to trickle in. But I hope that everyone is doing well on this Wednesday evening, yet another COVID Wednesday. Awesome. All right, we've got enough people in the room. I think we could formally welcome everybody to this week's program of the Fighting Back Lessons from AIDS for COVID-19 series that we are doing. Tonight, we're going to be talking about the topic is on pandemic sex. How do you navigate sex in a pandemic, and all of the questions around that. I'm Lee. I use they, them pronouns, and I'm the museum operations manager with the society. And what we're going to do is I'm just going to do a little bit of Zoom housekeeping if you've never done one of these webinars before, and give you an idea of what the evening will look like. And then I will pass it along to our executive director, Terry Beswick, who will be moderating the conversation. So if you're attending this webinar, you have a couple of different options on the bottom of your screen that will allow you to interact in different ways. So everyone has access to the chat. If you click the chat bar, the chat button, you should be able to see a panel come up on the right side that says Zoom webinar chat. Please, throughout the whole conversation, if you want to talk with other attendees or start a conversation as you're reflecting on what the panelists are saying, feel free to utilize that chat. Just make sure that if you want to send a message that everyone will see, you need to make sure to select all panelists and attendees. If you'd like to send a private message to any one of us as panelists, you can also see a list of it in the chat bar. And we're going to have about an hour and 15-minute conversation, and then we'll switch over to a Q&A segment. We have the ability to take questions throughout the entire evening. So you have the option, there's a little like two chat bubbles, that's the Q&A. If you have questions that you'd like the panelists to address, please send those in via the text function, and we'll be able to have a queue of them, and we'll select the questions to be answered. Please feel free to send them in as you get them. If you've got a question that you're not sure you can remember until the end, feel free to throw it in, and I'll just be watching it from behind the scenes. And then also, if there's something that you really during the Q&A want to interject verbally and aren't able to express via the chat panel, you can press the raise hand button, and I'll be able to see who is kind of flagging me. And with that, I'm going to turn it over to Terry Beswick and welcome all of our panelists. Terry, you're muted.
One of these days I'll catch on. Lee, thank you very much for your work behind the scenes. And I think we've got this streaming on YouTube as well, so people can also be checking in to that there, and it's going to be archived on our website. So I'm really excited about tonight's panel, and I'm really grateful for everyone that is joining us here on the panel. You guys are all going to bring something different and unique and fantastic, I'm sure, to the conversation. And we're really going to be able to skim the surface of a very complex subject, of course. Just by way of background, the Fighting Back series, which we used to do in our physical museum on a monthly basis, really started around the 2017 upon the inauguration of the current president. And we really wanted to provide a way for us to bring people together to talk about contemporary social justice issues in particular, and put them in a historical context. And so we have a lot of archived panels. I think several of you, I know, Race, I think you were on one. But we have a lot of them archived on our website. So I encourage everyone to check those out. So this is now turned into the last couple months into a weekly series and online, of course, and we're looking at, in particular, a special focus on COVID-19 and looking at it through the lens of HIV and AIDS. What lessons have we picked up from HIV and AIDS that we can apply to the response to COVID-19, in particular in the LGBTQ communities? And so there's a lot there. We try to bring together an intergenerational panel, a diverse panel on a weekly basis that either brings expertise or current experience to look at things from a different perspective. And so, we try to keep this fun and light, and I encourage people to just sort of converse with each other or ask each other questions. And if anybody that's watching, you have a question, just pop it up at any time. And if we don't get to it immediately or in the course of our conversation, we'll definitely get back to it later. So let's see, with that, yeah, what about sex? That's tonight. And so, I'm hoping that we're going to be able to address a few general questions. And in particular, I'm interested in looking at what does it mean to be single right now in terms of this lockdown, shut-in, whatever we want to call it. Or what does it mean to be in an open relationship, a kinky, polyamorous relationship in the queer community in particular? What does it mean to be a sex worker or a client of sex workers right now? And in particular, and I just want to say that the idea for this particular forum came as a result of engagement on Facebook and social media. When we were starting to see, and Brendan, I saw your smile, yeah, there was one conversation in particular. Brendan was stirring up something about people shaming people for hooking up, particularly in the early days. And I think people's attitudes have kind of changed over the course of the last couple of months. In some ways, they've settled in, and in some ways, they've settled back, I guess. So I think looking at it in this moment in time, we just want to be aware of people's growing knowledge of what the risks are around COVID specifically, and what behaviors are appropriate from your perspective or other people's perspective, and how do we modify those behaviors or encourage behaviors that are safe. I just want to encourage everybody to look at this from a harm reduction perspective. I'm looking at everything from a harm reduction perspective right now. Today I went to the farmer's market, and it's kind of like it's a little bit sterile. Nobody's smiling at each other, because we're wearing masks. But I had to get out. I had to get some food, and I had to come back, and so that's taking a certain amount of risk. So everything we do has some risk attached to it. But in particular, I'm hoping we get into talking about hookup culture, apps in particular, what's going on with apps, what's going on with sex parties, where are they happening virtually and in real life. And so there's a lot there. So I just want to briefly introduce our panel, starting with Race. Race Bannon is a good friend of mine, neighbor here in the Castro. He's been an organizer, writer, educator, speaker, and activist in the LGBTQ, leather kink, polyamory, and HIV/STI prevention realms since 1973. He's authored 2 books, been published extensively, spoken to hundreds of audiences, created the world's largest kink-friendly psychotherapist and medical referral service, and was a leader of the DSM project, led to a beneficial change in the way psychotherapy views BDSM. He also currently writes for the Bay Area Reporter and has a wonderful column there, and also a website that lists events in the leather community here in San Francisco and elsewhere. Eric Cervini, I got to know Eric a little bit online. He doesn't know me, but I've been a fan of now I'm blanking on the name, the podcast. He's going to tell us about it. And Quarantini, that's it. Really fascinating, a lot of book discussion and fun talk. So he's an award-winning historian of LGBTQ culture and politics. He graduated summa cum laude from Harvard College and received his PhD. Do we call you Dr. Eric Cervini? It's okay.
Whatever.
Just
Eric's fine.
Just when we get to know you really well, right?
Right.
Okay. And so he has a PhD from history from the University of Cambridge. Niece went there, where he was a Gates scholar. His debut book about Frank Kameny and the American homophile movement, The Deviants War, The Homosexual versus the United States of America, will be published by Borar, Strauss, and Guru in June 2020, and I'm really looking forward to reading that. So, and Luis, thank you so much. Luis Gutierrez Mock, PMPHMA, is a queer Chicano white trans man from the Bay Area who has worked in the fields of trans health and HIV prevention for 20 years. He currently directs the Triunfo, oh gosh, I should always look up pronunciations beforehand. Triumph, correct me if I'm wrong, project at the University of California, San Francisco Center for Excellence in Transgender Health, a trans prep demonstration project. Thank you for being here. Celestina Pearl, AKA the Van Lady, is an artist and longtime sex worker with many years of experience in the many facets of the sex industry. She currently is the outreach manager of her St. James Infirmary here in San Francisco and drives her van around San Francisco, hence the Van Lady, serving the health and occupational needs of folks working and living on the streets, trains medical students to perform sensitive, competent pelvic exams, and is raising a brilliant child. Brendan Schuchart is a writer, actor, political organizer, and advocate for people living with HIV. His writing on issues of HIV-related health and stigma have been called humanizing and heartbreaking, and beautiful, honest, and important. These days, Brendan devotes most of his time and energy to the never-boring world of San Francisco politics, where he works to advance progressive causes and candidates, and sits on the boards of both the sex-positive Dems. I didn't know about sex-positive Dems. That's new to me. Maybe you can tell us about it. And Alice B. Tokless LGBT Democratic Club. Brendan's a good friend. Thank you all for being here tonight. So let's plunge in. With all that preface out of the way, I see some chats coming in. I'm going to take a look at those as we go. And I want to open it up and kind of let's back up and start at the beginning and talk about HIV and AIDS. Some of you, like me, can remember before we had the term HIV, that we had GRID, and before that, it was just, we didn't know what it was. And there was a growing period of understanding of what the risk factors were around transmission. But if each of you can kind of talk a little bit about your work in relationship to HIV and AIDS, or just how you think about sexuality with respect to HIV and AIDS now, and how the trajectory of our understanding has changed over time, or just talk about whatever you want to talk about. Maybe I can just go around the room, and I'll start with you, Race, if that's okay.
Sure. I'm probably the oldest person on the panel by far, so I go back to
not too far.
I knew the very first case of HIV in Los Angeles and got very engaged very early in HIV activism, and was a volunteer with the very first Safer Sex organization on the West Coast that I'm aware of anyway. I think there are comparisons to HIV and COVID-19, and some absolutely apply and some do not. And I think the thing that does not apply is that we are quickly learning a lot about this because it affects everybody. So therefore, all the resources are pointing at it, unlike when it was primarily gay men getting HIV. The resources certainly weren't there. And so the knowledge rolled out much more slowly. So the reactions were much more slow. The Safer Sex was very rigid and stayed fairly rigid for quite a long time because we didn't have a lot of knowledge. With something like COVID, every day we're learning something new because all research is pointed at it. Therefore, I think the way we deal with sex and COVID is going to evolve much more quickly than it did with HIV. I'll start there.
That's a great intro. Where shall we go next? Celestina, you're right below Race on my screen.
So yeah, I mean, I remember as a child when, when we first started hearing about HIV and AIDS. Actually, I think at that time people weren't even using the term HIV. It was just AIDS, and unfortunately, people out on the street who are not in the world of medicine and academia still think of it that way, and it still carries a lot of stigma. Um, and of course, like, the big difference is the stigma. I mean, there's not the kind of stigma and bias against an entire large group of people. It's anybody. It's airborne. Anyone could get it. um i guess uh I guess what you're asking around is around like history, and my daughter's papa, who's a trans man and grew up as a child in the Castro from the late 60s onwards. And so I got to hear a lot about San Francisco's history from them. And, it's heartbreaking to hear about it, from their perspective as a child. All of their, basically all of their mom was and is, a hippie mama fag hag. And so all of their friends were all gay men, as part of their, not all, but a lot of gay men that were, part of their family. And they lost all of them. So, it's really, I feel that, through him. And just as I have navigated my way through San Francisco for the last 20 years, and I have gotten involved with HIV and STI testing. I'm hearing that there's maybe some audio problems. Are you all able to hear me okay? It's okay for now. Okay. Maybe I'll try to speak a little more slowly, maybe, so I can be heard. So I mean, for the past almost 20 years, I've been involved in HIV and STI testing, primarily with St. James Infirmary. I started out doing triage and then also doing venue testing. So we would go like to Arrows, to Nob Hill. Those are the two main places I can think of where there was like a lot of gay men. And I appreciate being welcomed into that community. And as a queer woman, I feel like an ally in that world. And I feel like I can contribute, as a nurse and as an ally and as, somebody who's sex positive. And a lot of times we'd see folks who are visiting from out of town, and the idea of even being able to talk about sex and, testing and, that it's, in San Francisco, I think we kind of take the sex positive atmosphere that we live in for granted. But, so many other places, most other places, perhaps, there's a lot more sex negativity and fear around gay sex, around sexuality, around HIV and STIs. So yeah, and that, with COVID, it's definitely totally different. I think it's very different in that way, but I do appreciate, being able to have that conversation around, the compare and contrast. Thank you.
Great, thanks, Celestina. A lot to get back to there, and I'm sure we will. Luis, can we hear from you?
Yeah, so I've been working and volunteering within HIV prevention, primarily within HIV prevention amongst transgender populations since 2000. So for 20 years now, which seems amazing to me. And, I grew up in the Bay Area. My parents are both nurses. My dad was an emergency room nurse. And I recall, very frank conversations around the dinner table about grid and about, being nervous around providing care for a disease that nobody understood, and and recall, the advancements that were made as testing became more readily available and as it became more clear that HIV was, transmitted through, through blood, through seminal fluid, through, through the various means in which it is transmitted, but that wasn't known at the time. And I see, we have a lot of parallels now that we're just like, we don't know about fomite transmission. We don't know if surfaces, the extent to which a surface could be able to transmit coronavirus. We just don't know that. We know that the virus can live on a surface, but we don't know for how long it would remain contagious, at a level that would remain contagious for people to be able to transmit it to themselves. The largest parallel that I can see between HIV and coronavirus is really the ways in which disease highlights inequities that are pre-existing within society. And so while, sort of theoretically everyone is at risk because this is an airborne disease, we're seeing that the populations that have the highest inequities are bearing the brunt of this disease. And, I frankly think that that's a large driver behind why our country is really focusing on the economic impact, because the reaction would be very different if the population that was placed at highest risk were older, white, cis straight Americans. Our response would be very different. Or if it was just even, just white folks in general. We are seeing that folks of color in San Francisco, particularly, Latinx populations, I think are like 84, 85% of hospitalizations. And so, we have huge inequities based on various demographics. And another similarity that I see is that SOGI data is not being captured for people who are testing positive. So sexual orientation and gender identity data are not being accurately captured. And in many parts of the country are just not being captured at all. In San Francisco, if somebody is presenting like at SF General or in one of the SF funded clinics, that data would be theoretically captured in some way, in addition to racial and ethnic data, which is also not being captured across the United States. But there's this way in which, again, the community, like for HIV, the community that is placed at greatest risk for HIV in this country, by far, trans women of color, Black trans women. That data is being silenced right now in the very same ways that within HIV, that data was silenced at first. It was, trans women were collapsed within MSM. There was no disaggregation of data. That did not end up happening within the CDC until I think the CDC agreed to do that in 2009. And then it took them several years to be able to update their forms. But we're seeing that. So this inequity is just being replicated again and again. And I think that, to me, that's the greatest parallel.
Awesome, Luis, a lot to dig into there as well. I'm going to go to Brendan. And Brendan, it's Brendan's fault that we're doing this forum, so maybe he can tell us about that.
So I guess before we get into why we're doing this forum, I'll talk about my experience with HIV, which was very different than I feel that everybody who came before me. I grew up in San Diego, and I'm 39 years old as of a couple of weeks ago. And growing up in the 90s in San Diego, we didn't talk about HIV. It was invisible. I knew it existed because I had been a little kid in the 80s, and I remember like seeing the Ryan White movie. But coming out in San Diego in the gay community, it just wasn't discussed. And if it was discussed, it was discussed in hushed tones. And when I did find self-HIV positive at the age of 24 in 2005. You know, I thought my life was over. Luckily, an ex-girlfriend of mine talked me into moving to San Francisco, where I, you know, found amazing care, but still was very unpolitical until 2008 when the economy collapsed and Governor Schwarzenegger proposed eliminating the AIDS Drugs Assistance Program, which I realized would mean like the death of many people that I cared about. And I ultimately got involved with an organization that is now sadly defunct called Project Inform, which was the oldest HIV advocacy organization in the country, and spent 8.5 years on the board of that organization, and it's very sad that they're gone. You know, I have spent most of my engagement with HIV as an advocate, as a journalist, and I tend to think about the culture around HIV and around, you know, like that, and that thinking has spread to my thinking around the coronavirus, right? And so the reason I suppose that we are doing this this panel is because in the very early days of this crisis, I saw a lot of my peers, a lot of my friends, a lot of very history-minded HIV advocates and activists doing a lot of generalized finger wagging about gays on Grindr, gays hooking up, and I finally had to say something, which was, you know, we abandoned this kind of general shaming as ineffective around HIV, and why would we recreate it now? And Terry and I got in a bit of a back and forth, but he very generously said, like, let's have a panel, let's talk it out, and here we are. And so thank you, Terry, for the invitation. This is very exciting.
Thank you, Brendan. Eric, can you pick us up from there?
Sure. No, I think all of those are such great points. And, you know, I'm a historian of the 60s and primarily. And so I think one thing that really strikes me about the AIDS crisis and the similarities is how, you know, people were celebrating an end or at least a newfound element of gay liberation that, you know, and freedom in when it came to their behavior and sexuality that crisis really threatened. And I think now you're seeing something a little bit similar, not just in terms of the incompetence of the government, but also right now, I know I certainly think anyone living as a queer person has felt the fear of that goes along with having sex and being queer. That I think if you can afford it, you know, PrEP is something that was helping combat that fear. And I think just as we're starting to make that more accessible, even though Gilead has its own issues, I think now at least having the conversation about how do we separate, you know, this idea of being sex positive with a disease, right? How can we still celebrate intimacy and make sure that we are not shaming anyone for being human, while also protecting not just ourselves, but our elders and the survivors within our community who now more than ever need to be able to tell their stories. So I think I'm so glad that we're doing this conversation just so we can have a conversation to talk about that.
Yeah, great. Thank you, everyone, for getting us started with this. And it's hard to know where to begin. I've had, like, my brain is rattling with all these different kind of questions that I want to approach this from, but I kind of like want to back up, first of all, from the the apps issue and the public shaming issue. Let's come back to that and talk about, you know, what kind of messaging is appropriate and how people can sort of encourage behaviors to the extent that we know what is, you know, an appropriate behavior. And I just want to like talk about issues of intimacy, issues of connection, and I think, you know, and I heard each of you talk about that in a certain sense. I mean, you know, the entire world, pretty much at this point, or a lot of the COVID impacted nations are dealing with various levels of lockdown and isolation, and so we're feeling a lot of disconnection right now. And if you're a sexually active person, maybe that's magnified in some ways, especially if you're not, you know, quarantined or isolating or sheltering in place with a sexual partner. So what, how are you seeing that? You know, we're, what is this in San Francisco? I think we're day, I don't know what day we're on, 46 or 47 day of shelter in place. You know, what are you seeing in yourself, in the community, in terms of the impacts around that? If you want to relate that to HIV or AIDS, that's great. But I think, can you address that? Race, what are you thinking?
What I'm seeing is what I saw happen sort of quietly as HIV unfolded was people making these personal decisions about risk assessment, harm reduction, what risk they were willing to take. A lot of things that were being done privately as sort of individual pacts with themselves or with others was done silently because it was considered a bad thing to take any risk whatsoever. But human beings being human beings and needing touch and intimacy and needing sex, at least many do, they made these harm reduction personal models that worked for them. They fluid bonded with somebody. They only had sex with certain people. They might have had protected sex. They might have not. It all depended upon the kind of deals they made with themselves and with others. And I'm seeing the same thing unfold here. I have already myself been contacted by someone saying, oh, are you interested in being part of my sex bubble? So they are already reaching out and saying, would you be part of that intimate group that knows each other really well and would sort of agree that for now you're only having sex with each other? And they're talking about a bubble of a few guys. And I know someone who has already gone through the process of recovery. Actually, he was entirely asymptomatic. His roommate was sick. And he is now playing with somebody else who has antibodies, and they've just decided this is going to work for us. So they've made that decision based on the science they know today. And that is something I am seeing rapidly happen because people are seeing this, unlike HIV, they're seeing this as having a light at the end of the tunnel. Whereas with HIV, it was entirely open-ended, and frankly, it was a death sentence. And while this is potentially a death sentence, back then, HIV was essentially a death sentence for almost everyone that got it. So they're making different assessments and different harm reduction models, and I'm seeing them unfold very, very quickly. I do think most people are not hooking up right now, or if they are, it's with somebody they know extremely well. But as was pointed out, finger wagging is a really, really bad way to get anyone to change their mind. And I think we have to accept that people are doing what works for them and not judge it, even if we decide not to do it ourselves. I think that's a really important thing. People are going to have sex. They're going to figure out how to have sex, and they're going to do it within the harm reduction model that works for them.
Brandon, are people hooking up? What's going on?
I mean, yeah, people are hooking up. You know, so I early on made an arrangement with an ex-boyfriend of mine, which was working pretty well for a while, because I'm I am a sexual being. I need sex, and I live in a house where all of my roommates have partners, and except for me, and that was that made it just all the more excruciating. But you know, I think that race is the right point, right? Like in the end, you know, like if you look at it globally, right? Like there's spectrums of you know, you have like Dubai, where I have friends who are only allowed to leave the house once every 5 days with a pass from the government, you know, to the relatively lax standard of San Francisco, where we can like go for walks and like peruse the farmers market. And then there's, you know, famously Sweden, where like life is, you know, minus like large concerts and stuff, like life is carrying on normally. There isn't a right or wrong way to do this. We all, to some degree, have to like make decisions that make sense for ourselves and those around us. You know, I myself, I haven't got the antibody test, but I'm absolutely certain that I've already had the coronavirus. I lost my sense of smell. I was very sick for only 4 days, but I happened to be on ritonavir, so I just happened to be on the drug that is supposed to make this go more quickly. But I do have roommates that I want to protect, and I want to minimize their risk. You know, I don't want to bring virus home on me, right? You know, and I do want to, one note on shame, right? There is this like kind of in the news right now, this, or in the gay news anyway, this like, what are they calling it? The meth gala, thanks Twitter. This New York party where a bunch of gays decided to have a underground circuit party, and some adult film performer live streamed it. Oh God.
As one would, I mean.
I guess that like, that even stretches my desire not to inject shame into the conversation. Like, I mean, like, I want to wag my finger. That is unacceptable behavior.
Was it the broadcasting or was it the actual event?
You know, I mean, like, there were 2 sins committed, right? Like, don't do something incredibly stupid, and if you do something incredibly stupid, don't get caught. So it just like it made us all look bad, and it endangered them and like everyone in their lives. And you know, I was reading, there's a, you know, that a one-on-one interaction is relatively safe. You know, whatever that interaction is, if you're talking to your mailman, or your roommate, or your grocery store clerk, right? It's when you have 50 of those interactions in a, you know, hour span of time. That's why so many grocery store workers are getting sick, because the volume of interactions they have. And so like, that was not good risk management at the very least. Yeah, I guess that's all I have to say about that.
That's great. Anyone else want to have a thought that you want to share on this? Bruce.
So I can,
Please, Luis.
yeah, I think that I want to start by saying I deeply believe in harm reduction for STI prevention and HIV prevention, and the ways in which, you know, a lot of that is now, it's based on science, right? It is based on an accurate understanding of HIV risk. And we currently don't have an accurate understanding of risk for COVID-19. So for me, it's really difficult to think through communicating what harm reduction could be for COVID-19, because we don't understand the risk. You know, we don't understand the risk of potential aerosol transmission, where the virus may be living in the air likely would be based on somebody with an incredibly high viral load. But we don't know. There's not enough known, and the science is shifting rapidly. And I think that particularly in the United States, where people just don't believe in science for some reason, there's a lot of people just think that this is a huge conspiracy, or it's a lie. There's also a lot of communities where modern medicine has just there's very valid reasons for people to distrust medicine and the medical field and science, particularly amongst communities of color. And I think that communicating harm reduction, it's difficult. I've seen what New York State, or it was New York City, the safer sex in times of COVID-19 information that they handed out. And, yes, very helpful, really great ways for people to potentially reduce risk. And this is not HIV or STIs. The risk is not between two individuals and then only their sexual partners, right? So the ways in which I've been trained to think through what harm reduction is are, for me, completely inadequate in thinking through this disease, because the harm caused is not only to me and my sexual partners. The harm caused is to me and the grocery store employee who I see during my once every 3 weeks outing to the grocery store, right? And the potential for harm caused is so much greater. And then how do we communicate that to folks? The participants who I'm working with in my research study that I'm on right now are majority undocumented trans Latinas, and a lot of them are sex workers, and some of them are still engaging in sex work. And for me, communicating with folks who are our participants, we've just been trying to say, here are some ideas about what you can do to potentially reduce your risk of transmitting or catching this virus. And also, we don't know if this is sufficient, and none of this is safe. I think that for me, it's fine to say, these are the things that I'm going to do to reduce harm, and to also, acknowledge that we don't know if any of this is safe. We don't know what of this is adequate, and our data is changing rapidly. So I think that's sort of where I'm at, and thinking through what messaging would be like to communities, and asking people, asking sex workers, can you make it hot to wear a mask? Can you do a scene with a mask on? Can you tell the folks who are hiring you that you're going to really get off on them wearing a mask? Can you not kiss on the lips? Can you not rim anybody? Can you try to, use a condom for blowjobs? Things like that are, what we've been talking about with our participants. And also just overall, we don't know what risk is. So if we don't know what the risk is, how can we adequately address harm reduction?
Yeah, I think even researchers and scientists are basically lay people with regard to this, and so everyone's kind of trying to mitigate risk according to their best guess or judgment, and I think that I'm going to see if we can pull up that document that you mentioned, and I know the San Francisco Health Department also. Maybe you can post it for us, Luis. The San Francisco Health Department also came out with a sort of a sex guide, how to reduce risk around sex during COVID. I didn't find it as fun as the one from New York. The New York one sort of had a little bit more of a kink feel to it, which was cool, recognizing things that people actually do. And I know during the development of the HIV prevention modalities in the 80s and 90s, there was a point in time where people recognized that the CDC approved prevention messaging was not reaching people because it didn't talk about the things that people actually do. It didn't use the word fuck, or didn't talk about sucking without a condom and all those things. And so people sort of had to find their own way around that. But I think to speak to the point of shame, I think there was a growing awareness. Race, thank you for posting that. And Luis, there was a growing awareness that by shaming people, that basically, or by giving them banal messages that they couldn't relate to, that people were tended to hide what they were actually doing, and then they couldn't be reached with any kind of effective messaging. So Celestina, Luis talked a little bit about sex work. Maybe we can use that as a segue to talk, how in terms of you or anyone that you know in your work, how are people navigating this around work?
Yeah, so I think that there's a bit of overlap in our communities that we serve. There is a fair amount of trans Latinas. We specifically go out on the street around the Polk Street area and serve the ladies while they're on duty. They're on the stroll, and we chat them up and offer them resources. And but one of the things that I was really thinking about was just all of the co-occurring risks that our communities are experiencing, homelessness and, loss of income. And for sex workers in particular, their work is illegal, their bodies are illegal, their lives are illegal. And, there's therefore they can't have protections, and therefore they can't have the same kind of worker protections. So they're faced with they're faced with a complete loss of income, or taking the risk of of getting COVID-19. And then also the issue of, because of the shelter in place, the Johns are not coming out. So not only do they have to make a decision about whether or not to risk working, but the source of that work is also being taken away because of, other people's choices, which, I mean, of course I agree that people should be, sheltering in place as much as possible. And also it makes it very difficult for so many people, and that's where we need government help. And the government help is just not there for the most marginalized of our communities. It's so frustrating when I see how those that have the most get the most, and those that have the least are getting the least. And I'm seeing that just all across the board in so many communities, and most especially the communities that I serve are homeless communities, street folks that are involved in street-based economy, dealing and sex work, and just at so much greater risk in so many different ways. So even aside from the emotional needs of intimacy, which I think there probably are a lot of people that have a lot of preconceived notions about sex workers and homeless folks, and that they are that they're choosing to take all these risks. You see a lot of folks out there who don't have masks, and of course, some of you may have seen the footage of the stark difference between the way that the police are dealing with different communities, such as handing out masks to white folks in the park versus versus beating the shit out of Black people and not offering masks and arresting them. You're muted, Terry. I think you're trying to say something.
Did it wrong again. Eric, I'm going to come to you to try to talk about, maybe you can help us to kind of put this into some kind of a historical perspective. And I understand you're a historian of the 60s. You're also a queer historian. But just in terms of the, the academic way of thinking about this, how can we kind of like use the current situation in a or use the past to inform the present, and how will we think about this, I think, in the future, maybe the future being a week from now or a year from now. But Celestina, I also wonder if you can just follow up and just talk to us a little bit about the impact of SOSTA, FOSTA, the laws that basically shut down a lot of the online connections for sex workers. In my world, I think about Rent Boy and all that. But has had a huge impact, and a lot of sex workers were forced back out onto the street to try to make a living. But now they don't have like either one. So is that what's happening basically?
Yeah, well, I think due to a lot of different factors, you end up getting a whole lot of push and pull, and people's lives being greatly affected by the choices of people whose lives are completely unaffected by, by this legislation, and also, other political decisions. So, you've got FOSTA SESTA. Immediately after FOSTA SESTA, there, were a whole lot more people who, for whatever reason, ended up back out on the street or back out on the street, their choices being limited. And then the greater influx of sex workers out on the street then led to a lot of folks who are homeowners and wanting to rally around quality of life issues, and then putting pressure on the police to then, institute the what do they call it? The prostitution abatement task force in Mission, and then so that crackdown, we definitely see that day-to-day flux of, we see higher police presence and then less sex workers, probably having to take greater risks, and who knows where they're being swept away to and being arrested, and then the shelter in place, and then the shelter in place happening, loss of income because loss of clients, and then loss of opportunity to work, and more police harassment because of enforcing shelter in place orders. So it's just, so much back and forth and so much upheaval in a lot of people's lives when they're just trying to survive, and with very little support.
Yeah, and I think of like during the early years of the HIV/AIDS epidemic that there were a lot of stereotypes around sex workers, more commonly called prostitutes back then, and in terms of like spreading disease, and so there was a lot of work for AIDS activists to ally with sex workers and try to educate people about how sex workers are actually practicing and teaching safe sex, and I'm wondering if there's going to be like a relationship or role or like a heightened awareness that comes from COVID with respect to sex work now.
Well, I definitely, I feel like, for many years, like the communities that I've been involved in have been very much that cross section of, gay men sex workers, HIV activists, and just folks trying to support a lot of cross sections of the queer community, and then and the handful of straight people that are also part of that community.
Yeah, and I think you said earlier, that this epidemic, like AIDS, or somebody said, just how it targets, or it seems to raise the visibility of those who are least advantaged among us, and so I think that there is opportunities for education around that. So Eric, and I'm kind of like thinking about, I'm not sure how old you are, but when I came of age in the age of AIDS, and came out and was coming to terms with my sexuality. It was part of the gay civil rights movement era, or post, the advent of the gay civil rights movement era, that we were hit with this. And especially young people, always thought about young people who were trying to come out and had this new thing, this new specter. It's like sex equals death, um, and what are the repercussions of what we're experiencing now? How is this going to affect the trajectory for the advancements of gay civil rights and just gay sex positive attitudes?
Well, I think the good news is that we can learn and look back at the AIDS crisis and see what did work, especially when it came to behavior modification. In the 1970s, the estimates say that 1% of gay men were using condoms, and then within 5 or 6 years, that went up by a factor of 70%. And I think you're going to see that now, as we recognize that we are human and people are not going to stop having sex, it is a human need. We're going to have to find ways of having sex that are still responsible. And I think having that conversation and also demanding from the government that information and those kinds of studies, recognizing that it's a given that people are still going to have these needs and need to see each other and need to have sex with one another. How can we best protect ourselves, protect others, protect our elders? And I think we do need to start preparing when it comes to equity. As soon as there is a treatment or a vaccine, I think we're going to have to start preparing now. Just as you saw in the second half of the 80s or the AIDS crisis, of ensuring that those drugs are actually accessible to all. I think the number one thing we can prepare for, whether it's the Gilead drug that's just been approved, is these will not be accessible to everyone. And I think we need to be holding not just the government, but also corporations accountable, because this is a human right, is having access to these drugs or whatever vaccine is coming. And so I think we need to start mobilizing now and brainstorming for how we're going to ensure that these are not divvied up solely to the Tom Hanks and to the celebrities of the world, just as the initial test suggests they will be. And I think also when it comes to general civil rights, I think the one thing history has taught us is that those in power will always try to find a distraction or a scapegoat for whatever failures in policymaking that are occurring. And I think we also need to prepare as the LGBTQ plus community, not just for our own rights being taken away, but for other rights that may be taken away, whether it's immigrants, whether it's Asian Americans, anyone who could possibly be allocated blame for the regime's own failures. I think that's something that we need to look out for, especially in an election year. But I think it's inevitable. It's going to happen, and we need to be vigilant.
Yeah, and thank you. I didn't have myself muted this time. Okay, thank you for. Luckily, my dog didn't start barking. Thank you for highlighting, especially treatment access, which was always, whether it was treatment development or treatment access, it was always an issue with AIDS. It was very close to my heart, and I spent a lot of time working with Project Inform and other groups to try to advance those causes. And Brendan, I've really been missing having Project Inform around right now, and it's really unfortunate that they decided to close last year, because during the course of their existence, they broadened their mission to include hepatitis C, for example, and really increasingly looked at the totality of health access as being part of their mission, and not just specifically HIV treatment. And so do we need something like that now I mean, do we need a group that's just like about providing information and advocacy? And I know like Lido posted, you know, the AIDS Foundation posted something about sex with relations to COVID, and, you know, and I know people are doing certain work, but are we seeing enough? I mean, I remember during the early years of AIDS, we had, it seems like a new organization started every week. I think I started a few of them myself. So are we gonna, do we need that?
You know, I also have been feeling the lack of Project Inform, right? Like that was such just a wealth of just so much concentrated knowledge and passion in one place. And we are lesser as a community for not having that resource to rely on. I think the reason that we saw a proliferation of AIDS organizations, you know, like you said, like a new one every week, was because nobody was going to do it for us, right? Like there was, the federal government certainly didn't seem to show any interest in stepping in to help us. You know, we had to do it ourselves. Not that the federal government is showing an incredible competence in handling this crisis. I don't know. I mean, there is some good stuff coming out of the AIDS Foundation. But again, I think part of the problem, as Luis was saying, is we don't have accurate medical data on exactly how, when, and where the virus is transmitted, really how infectious it is, really what the fatality rate is. It seems to be different from city to city. You know, like, what was it, like 90% of people who go on ventilators in New York die, whereas one person who has gone on a ventilator has died here in San Francisco, and we don't know why. So I don't know. Yes, you want to start an organization, Terry?
Yeah, let's talk.
You know what? We don't have to do.
I mean, my hands are full, but you know, I like to get things started and then walk away. You know,
Terry,
but
I think
but I do want to say, let me just say, Race, and I'll come to you. Is like Brendan, what comes to mind, and somebody else raised this question in the chat. I forget who it was, but you know, the LGBTQ community has a disproportionate rate of depression, anxiety issues, and the resultant effects of you know, alcoholism, drug abuse, and suicide, to begin with, you know. And some of us, like trans people in particular, have even higher rates, you know, and in different parts of the country. And then we've got this, the isolation. So the other side of the coin that people have been raising is around protecting our lives from possible infection. For some people, like if they were going to fully protect themselves, that may be the straw on the camel's back that pushes them into death from something else. You know, and people are experiencing loss of income and homelessness and all those things as a result of COVID. So you compound all those things, and it's really, you know, intimacy and connection becomes so important, I think. And Race, that was a question for you.
Oh, what I was going to say that came to mind when we were having all this discussion, which was all one, that when it came to HIV, we were able to identify a virus and very quickly give people gobs of erotic alternatives, as long as it wasn't insertive. And then once we figured it out, it could be insertive if it was covered, we gave them that option, which was pretty amazing. And the kink community, for example, came in very quickly and gave people all these different variations of what you could do without insertive sex. This is a whole different animal, because talking to each other could spread that, you know, I mean, kissing, we know absolutely could. So we aren't really able to give people great options at this point. And I think we're at a point where people are okay short term with abstinence or near abstinence. But I think we do need a project informed. We do need a group. Maybe the AIDS Foundation here locally will be that group that gives people guidelines on how to have harm reduction sex with whatever information we do have, because I think there is only so long the abstinence model or the only one person model is going to work. And so I do think we need a project informed, and we need the kind of an all hands on deck to come up with these strategies very, very quickly, because I think it's a time bound thing. And at some point, people are going to decide, I'm just going to have sex and not follow any guidelines whatsoever. So I also miss the project informs of the world.
Yeah, no, and I think some people are doing that, you know, and I think the real danger is that people are doing that on the DL, doing it secretly. I mean, I'm not saying they should broadcast it, but you know, that they're not like talking about people that care about them, talking to people that care about them. But I have one question for you, Race. It's coming from Jacob. I'm going to direct it to you, which is, what are some of the strategies that people are using to have sex, safer sex, and engage in BDSM that reduce harm? And given how contagious novel coronavirus is, and given all the unknowns, Race, you mentioned sex bubbles, and Jacob would like to hear more about that, as well as other strategies that he can use to adopt and permit his slave to adopt.
A lot depends on, do you live with your slave or not, and are you cohabitating? So I'm assuming that that's not the case. The strategies that are being offered range from remote control devices where you can play with each other over cam and, you know, control each other's butthole or genitals or whatever you want. There are certainly all the solo strategies. There are online sex parties. They're really just big masturbation fests. And there's quite a few of them. You kind of have to get invited into them because you have to know somebody. But
Can you post a link for us? I'm just, yeah. I'm asking for a friend.
We'll talk. And when it comes to in-person, unfortunately, it was referenced, you know, could sex workers wear masks? I have a sex worker friend who just did a session with a client where he and the client both wore masks. So it's already happened, that people are already adjusting to that. But we don't have a perfect way to do anything in person if you have contact with someone else, because you're only as negative for COVID as your last test before you breathe air somewhere. I mean, there's really no perfect, with HIV, for example, you knew. So I think that the strategies are either employ sort of remote things like cam, sex toys, things like that. I know people that literally do masturbation scenes 8 feet from each other in the same room, and they're very much voyeurs and exhibitionists, and it works. When it comes to dominant, submissive kinds of things, most of that takes place between our ears anyway. 98% of dom sub play really is a mental exercise, so employ that as much as possible, even if the physical can't happen. But I wish I had really good, solid ways that somebody could be physically intimate and have a really low chance of transmission. And I don't think that that really exists yet, because we don't know. As it was pointed out, we simply don't know enough about this virus.
Well, I know you're going to continue investigating and reporting back in your column and elsewhere. Okay, thank you. So I wonder if anybody can like address the question of, you know, as you try to form a sex bubble, let's say, you know, or if you have somebody that, whether you're paying them or they're paying you or not, how do you sort of reduce risk? And I'm not talking about like wearing a mask, but how do you pick a partner that you feel like is potentially less safe than somebody off the street that you don't know anything about? Is there anything? Brendan?
I mean, so, you know, just to touch just a little bit on what Ray said beforehand. Fuck your roommates. Yeah, it's an option. You know, I have been actually having a lot of fun with cam stuff lately, but it's like the phone sex we had in the 90s, but like better. That being said, like, I think everybody is going to yearn for human touch at some point or another, or many of us, most of us, right? I do. And, you know, if like if a condom was a barrier to intimacy, like 6 feet is significantly a bigger barrier. That being said, you know, in the early days of PrEP, I would and still do recommend that if you are going to have sex with someone whom you don't know, you might still want to consider using a condom, right? And maybe the safest sex we can have right now is with people that we know intimately, and not have sex with strangers for the moment, sad as that may be. I'm not thirsty anymore, I'm dehydrated. Sorry, I'm reading the comments. Yeah, I mean, that would be my first suggestion. Like, if you have to, if you, human touch is a biological need, sex is a biological need. And you know, the way in which we are protecting ourselves from this virus are detrimental. Like, I have roommates, and there's still days where I'm incredibly depressed and it's difficult for me to get out of bed.
Yeah, so,
Just
but I want to like circle back, and you know, and I hear you on the depression thing, and I think everybody's going through different cycles of that, and I just want to encourage anyone that's listening to reach out and talk about that, and you know, figure a way forward to do what you know works for you, to what has worked for you in the past around like working through depression, especially if you're predisposed to that. But I'm not speaking to you specifically about that, Brendan. I'm just talking about generally. I want to say with regard to, you know, picking a partner, a question that comes up for me is like, how do you judge their risk factor? If they haven't been tested, they don't have the antibodies, they don't know if they have the antibodies, how do you judge whether you know them or not? Like, what happens if you know them intimately, but they happen to be, you know, a frontline social worker who's interacting with people that are, you know, possibly COVID exposed on a daily basis, versus somebody that you know that isolates and only gets deliveries. You know, is that a factor for people, like looking at, you know, give them a questionnaire, like how many people have you talked to this week, or I mean, I think about like the early days of AIDS in the mid 80s. I had a friend who was a sex worker, and he told me about this one client that he hooked up with who literally wrapped himself in cellophane. You know, just wrapped himself in cellophane. And this is somebody that was knowledgeable about HIV, but just had this phobia around it, you know. But here it's like sort of like, you know, amorphous in a little bit. Luis, do you have any thoughts on this from your work?
Just in terms of forming, so I think you were using the language of sex bubbles. There's also the language of pods that people are doing, and I think that from what I've read on them is that, you know, generally one would want to try to seek somebody who has the same level of general risk as they do, and you know, assume that everyone is positive, quarantine yourself for 14 days, and then after those 14 days are up is when I've seen people post that's when they start to open up their networks of contacts. And I think that the component in here that's necessary for this to work and not increase one's risk or increase the risk for other people who one has contact with is that you have to, you know, be very upfront with each other about what behaviors and what potential risks you've engaged in. So, you know, like, you know, if, for example, you know, there's so many different ways of introducing risk right now that we don't know and that we don't understand. And so being able to share that with partners, you know, for me, some comparison can be made to the early days of serosorting, right? When we did not have the clinical research data that would follow up with serosorting. And, like now we know that for, serosorting within an HIV prevention context, that it's actually safest to serosort to somebody who's living with HIV and virally suppressed than it would be to serosort to somebody who, is HIV negative or unknown HIV status. And so I think that as much as we can, waiting until there's more data, because there will be more soon, and really trying to get a hold of the data sources that are communicating newer findings in ways that are accessible for folks and that are truthful and based on the current literature is really important. But in general, it's creating pods, 14 days of quarantine. That's when you can start being around a couple of people, like a very small amount of people.
Yeah, I think that sounds reasonable. And I think part of my own personal frustration about evaluating risk and what is okay is that I just don't have that information. And it's so difficult to find any sort of information, whether it's a study or whether it's anecdotal, certainly from the administration, but also from the medical community. And one thing I actually found before this, I've been doing a lot of reading just especially in the early days of the AIDS crisis. And I'm sending a link. I identify as an archive queen because I just love historical documents. And one of the, I think, most amazing documents that came out of the early years of the AIDS crisis is called How to Have Sex in an Epidemic. And I think it provides, it's from 1983. It was written by two doctors. It was actually edited by Richard Dworkin, which is pretty cool. And I think it gives a really good template for what I would hope physicians who may be listening or who may be also frustrated about their own inability to get their own observations out to the wider community. So whether they identify as queer or they have a lot of queer patients, I think we need to be empowering those who are actually on the front lines to say these are our observations, and also recognizing that people aren't going to stop having sex. There are ways of risk reduction without actually staying abstinent. And if you look at the document, it talks about, here's what we know about, even if it's just anecdotal, here's what we know about the risks of fist fucking. Here's what we know about the risks of poppers. Here's what we know, et cetera, et cetera, et cetera. And just having a compilation of all that information, even if it is purely anecdotal, but coming from those who are actually seeing it with their own eyes versus filtered through the government. I think that's one of the really optimistic takeaways of the AIDS crisis, is that you see this relationship between activists and those who are most afflicted and affected, and then those who are studying it or who are treating it without the government being involved. And I think that's a relationship that we should really be trying to emulate.
I just want to point out that Landy Cranston, I'm sorry if I mispronounced that, in the comments made a really good point, which is our decision on what risk to absorb isn't limited to our risk. Like, it often has more to do with the risk we are putting other people at, because we are probably at lower risk, many of us here on this chat, than you can accept more risk if you live alone and you don't regularly interact with someone who is elderly or immunosuppressed. If you have roommates or you are a caregiver, you by necessity can assume less risk.
Yeah, that's a good point. And I mean, information is definitely changing as we go. And remember, seems like a year ago, but it was actually just weeks ago that the CDC was saying, don't wear masks, and then it was suddenly you know, people were saying, well, what about common sense? You know, and so they had to say, and I think about, you know, during the, so much of the AIDS epidemic, the messaging was that oral sex is unsafe, and so people were like using a condom with oral sex, and I was like, ugh. And then it turned out, well, actually, you know, common sense led you to suspect that it wasn't actually particularly unsafe. And so people just began doing that. And I think that we saw that happen a lot. But yeah, I think with masks in particular, they're not so much to protect us, they're to protect other people from us, as you know, asymptomatic, or a great proportion of people who were actually infectious, and spreading it unknowingly. So yeah, so this is like it's interesting. I mean, with AIDS, it was a public health issue as much as it was about a person-to-person risk issue. And here, that seems even magnified, you know, that there are repercussions and of consequences of our actions. And so that kind of like circles us back to the shaming question. I just want to get to one quick question, and I know my mom might be watching, and I apologize, I got in trouble with her last week. But I do want to ask, because I want to know, what do people think about glory holes? Race.
Because I don't think we can say that they're any safer than any other mechanism. I mean, it's probably safer than kissing, but that person could have just taken saliva and played with their penis, and bam, there you go. Frankly, I love them, so I would love to say I think they're safer. I don't. I think the point it made earlier, the only real good harm reduction is 14 days, you know you're good, and keeping yourself to those people. I know people that have buddied up, and they're living together, they're quarantined together, and they figured that's how they're going to have sex through, you know, until they have more information. So I don't think glory holes are safe.
I guess we have to wait for the study, you know, I don't know.
Yes.
Okay.
I mean, it's contracted respiratory. So even if somebody's saliva, you know, if somebody had their saliva on their dick, then, I mean, if the other person sucks it, then they would get it, right? I don't know.
Right,
Just
because
the dick.
we're saying kiss it. Well, you know, you make a good point. We need
But
research.
like dick and ass
Yeah.
equals less risk of COVID, right?
Yeah.
Well, I don't know about the anal sex and less risk, because there have been several studies that have found fecal matter to be a source of testing for COVID-19. So, you know, I think that staying away from a butthole as much as we can is probably the safer thing. So if one would be using a glory hole, then I think that a blowjob with a condom that you could cheek would, or you just slap, whatever, it's a glory hole. It's not like, you know, you put a condom on it. But I think that glory holes, to me, sound much safer if somebody is going to engage in sex with somebody, particularly if, you know, it's somebody who they don't know very well. That is a harm reduction measure. Again, that is a harm reduction measure that we don't know what the level of harm is.
Yeah.
You know, so if somebody is going to engage in behavior, if they must, then that seems like a way to incorporate harm reduction with the knowledge that we don't know what this harm is.
All right. No, I see my boyfriend coming in. I see
unless
my
we're talking
boyfriend coming in here. We're gonna get in trouble. Celestina, go ahead. Go ahead.
I was just gonna say, just recently a friend sent me a text message that had a lovely image of a magical unicorn in the glory hole. So it seems like that probably would reduce your risk of COVID-19.
If you want to post it in the chat, you know, but you know, here, I mean, we're talking about two different paradigms at the same time. We're talking about clinical levels of risk around specific acts, but then separately we have to talk about who is it, you know, and what is their risk factor level, and then they have to look at it and say, what is the level of risk that the other person does, and what level of risk am I willing to accept to take home with me, or what have you. And you know, so this is tough. We only have 5 minutes left. And I apologize to everyone. I think we got through a lot of the questions in one way or another, I'm hoping. And I just want to give everybody a chance to make a 1 minute final comment. And if you need a prompt, maybe what do we do about sex? And, you know, where are we going to be 3 months from now, 6 months from now? What would you like to see us doing?
I'd like to see us keep talking like this, because information is power. And I think we're going to have to get the information sometimes ourselves via various mechanisms. And what goes into harm reduction around the sex for COVID-19 is significantly different than HIV, because it's a stew of factors. It is not one single transmission factor. So it's a tough decision to make. And I think we have to accept that each individual is going to make a different decision. But boy, I hope they do it with good information.
Yeah, we have to talk about it publicly, but then I think as with HIV, it was always about talking with your partner. You know, maybe that really speaks against the glory hole idea. You know, it's really, you have to talk and say, you know, are you positive? Are you not? Have you taken the antibody? Yeah. Celestina?
I just would say that I would really love to see us judging less, supporting more, and providing resources, being generous with each other, and even more so than, you know, than we already are, because it's ourselves and our communities that's gonna, you know, that's gonna keep us as safe as we can, and, you know, and loving us, and, you know, helping each other out with information, resources, support.
Yeah, that's great. I think everybody's got a story, and everybody's got their own set of circumstances, and just from the outside, you can't really know what everybody's going through and what the issues are. So yeah, that's really important to remember also. Luis?
Yeah, I think that right now, just thinking through sex and COVID-19, the most important thing is to put pressure on our electeds to be able to provide increased resources for our communities, and also to be able to conduct the research that's necessary. That we need not only biomedical research, which is the only thing being funded right now, we need behavioral health research. And then I'm just going to put a plug in that if anybody currently has a job, isn't able to work from home, to please donate your income. You know, donate a good chunk of your income, because so many of my community members are just struggling in ways that I could never imagine things getting worse for them. And it's really happening. So I think that as we're thinking through what sex looks like in terms of COVID-19, we also need to remember that people have other basic needs that are not being met.
Great. Thank you, Luis. I'm so glad I had you on the panel tonight. Thank you very much for being here. I'm going to go to Eric. What do you got?
Well, I think, you know, not just empowering doctors to be sharing information about how to be sex positive and how we can reduce our own risk, but also just ordinary citizens, regardless of so many people don't have the luxury of employment right now and are literally just sitting in their homes. And I think with that time, let's use that to actually mobilize, and also remember that with the internet now, the work that ACT UP did in the 80s and 90s of getting information into people's hands, which was so crucial, is easier than ever before. And just because, you know, you are not a doctor, you are not an elected official, does not mean that you can't do the research yourself. You can find data, you can read these graphs as well as anyone else, and perhaps even better. And I think that's one of the most important lessons of the AIDS crisis, is just how effective and how brilliant just ordinary citizens can be if they share information, they share their research, and it'll blow physicians away. It'll blow elected officials away. And now that we have the internet, you know, if you're watching and you know how to code or you know how to make a website and start compiling all the data you can find about, you know, what is my percentage risk of transmitting COVID if I go to a sex party with 5 people or 10 people or 15? What about just one in a week? Even if it's anecdotal, it's better than nothing.
Yeah.
I think now
that's a great point. You're speaking straight to my heart. And it's hard because we can't have meetings to do that, but I think there are ways to connect. We started a group actually recently on Facebook. It's called, for the Bay Area people, it's called COVID-19 Working Group SF Bay Area. Check it out there. It's just another place to sort of share information and ideas. Brendan, take us out. We're into overtime.
So I guess if I have like one thought I want to leave you with, it's that we need to count on each other. You know, sex workers aren't eligible for government grants, and the federal government is not going to give loans to gay bars. It's just not going to trickle down that far. Like you said, if you have a job, donate to your local gay bar, donate to a sex worker relief fund. If AIDS taught us one thing, a lesson that I think that we forgot in the subsequent years, is that we are all in this together. Nobody is going to look out for us as good as we're going to look out for us. And I think that in the good years, we got used to squabbling with each other, and maybe sometimes for good reasons, and maybe the good times are a time to squabble, but I think these times are getting rougher, and they're only going to get rougher, and we need to circle the wagons.
Great, thank you, Brendan. And so pleased that we had this conversation tonight. There's so much more that we could say, and I would love to have you all back again for one form or another next week. Please join us for Pandemic Art. And speaking of donations, tonight's event was free. If anybody would like to support the work of the Historical Society, we, like many nonprofits, are suffering a reduction in our income right now and are looking at difficult times ahead. So please go to glbthistory.org and consider becoming a member or making a donation of any size. Thank you, everyone, again, and wash your hands. Have a good night. That's great, Brendan. Brendan, love you. Thank you. Love you all. Have a good night.
Thank you, Terry.
Thank you, Terry.
Bye.
Thank you, panelists.
Bye, y'all.
Thank you.